back to my YouTube channel. This is Ivan Bial from BSBA Marketing A1. And so for today's content, we're going to continue my advocacy of HIV/AIDS prevention. And don't forget to click the subscribe button and the notification bell para ikaw ay laging updated sa upcoming videos ko. Adios! So first, let us talk about the complications of having HIV. HIV infections awakens your immune system, making you much more likely to develop many infections and certain types of cancers. So let us talk about the infections common to HIV/AIDS. First is pneumocystis pneumonia, or the PCP. These fungal infections can cause severe illness. PCP is still the most common cause of pneumonia in people infected with HIV. Second is candidiasis, or the thrush. Candidiasis is a common HIV-related infection. It causes inflammation and a thick white coating on your mouth, tongue, esophagus, or vagina. Third, tuberculosis, or TB. TB is the most common opportunistic infections associated with HIV. It leads cause of death among people with AIDS. Fourth is cytomegalovirus. This common herpes virus is transmitted in body fluids such as saliva, blood, urine, semen, and breast milk. If your immune system awakens, the virus surfaces, causing damage to your eyes, digestive tract, lungs, or other organs. Next is cryptococcal meningitis. Meningitis is an inflammation of the membrane fluids surrounding your brain and spinal cord. Cryptococcal meningitis is a common central nervous system infection associated with HIV caused by fungus found in soil. Next is toxoplasmosis. Toxoplasmosis can cause heart disease, and seizures occurs when it spread to the brain. And next is, let us talk about cancers common to HIV/AIDS. First is lymphoma. This cancer starts in the white blood cell. The most common early sign in painless swelling of lymph nodes in your neck, armpit, or groin. Next is Kaposi's sarcoma. Kaposi's sarcoma usually appears as a pink, red, or purple lesion on the skin and mouth. It can also affect the internal organs, including the digestive tract and lungs. And so let us talk about the other complications of having HIV. First is wasting syndrome. Untreated HIV/AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. Next is neurological complication. HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety, and difficulty walking. Next is kidney disease. HIV-associated nephropathy, or the HIV-AN, is an inflammation of the tiny filters in your kidney that remove excess fluids and waste from your blood and pass them to your urine. Lastly is liver disease. Liver disease is also a major complication, especially in people who also have hepatitis B or hepatitis C. So let's talk about the prevention of HIV. There is no vaccine to prevent HIV infection and no cure for AIDS. But you can protect yourself and others from infection. So these are the ways to help prevent the spread of HIV. First, use treatment as prevention of HIV. Second, use post-exposure prophylaxis if you have been exposed to HIV. Third, use a new condom every time you have sex. Third is consider pre-exposure prophylaxis or the PrEP. Fifth, tell your sexual partners if you have HIV. Six, use a clean needle. If you use a needle to inject drugs, make sure it is sterilized and don't share it. 7. If you're pregnant, get a medical care right way. And lastly, consider male circumcision. It is important to get tested for HIV if you suspect you have been exposed to it or if you engage in behavior that put you have a high chance of contracting the virus. You can get free HIV tests if you are insured, or you can seek out a location clinic that provides free or low-cost testing to anyone uninsured. There are many ways to prevent HIV, and participating all them will reduce your likelihood of contracting virus. Treating HIV early can improve your outlook and reduce the chance of transmitting it to others. So that's all. Thank you for listening to my advocacy.